Okay.
Okay.
Assalamualaikum and good evening. So today we're going to present post-traumatic stress disorder. This is our team member which is Muhammad Sazlan, Muhammad Haikal, Syed Muhammad Nur Fahmi Toha dan Syah Zain Chen. So this is the topic outline for this presentation, which is first we'll cover types, causes, symptom, treatment and case study. So
Uh, Now we're going to the type of PTSD. This is the, according to my research, this is a few types that have in PTSD. The first one is normal stress response. That is the response that activate the fight and freeze response in the body, like according to accident, illness, injury, or high amount of stress attention, like study, stress. And the second one is acute stress disorder. That is more like flashback to the director experience of a trauma, witness or learn an event that occurred in the person that caused reactions and repeated explore to extreme or repeated details of a traumatic event. And the third one is dissociative PTSD, like more to the high level of occurrence with other mental health or conditions. And they also have a flashback and amnesia. They're more similar significance with the history of early life trauma like sex harassment or some things. And the fourth one is uncomplicated PTSD. They were like we experience the trauma and avoiding place or people related to the trauma, but there is the only one PTSD that not coexist others mental health conditions. And the following PTSD is complex PTSD. They will repeat the response they were repeated or multiple trauma in over time, more than months or years. And they also have physical health symptoms like fatigue and chronic pain. And the last PTSD is comorbid PTSD. They will they will have a response at least one co-occurring mental health conditions, like example anxiety disorder, panic disorder, major depressive disorder, and substance use disorder. And now we're going to the causes of PTSD. Uh, Sometimes we know the person PTSD is like the mental health problem, so maybe they were caused by these four uh, causes. The first one is stressful experience, inherited mental health risk, inherited failure of your personality, and the chemical and hormone regulatory process in the brain. For the stressful experience, like the amount trauma that the individual experience, like they everyday work, study, stress, and inherited mental health risk. Maybe your family history has the experience anxiety or depressions. And for inherited failure of personality, maybe your emotional response, which like temperament, maybe you may be easy and anger, get anger, or and for the chemical or hormone, maybe the hormone inside your body is can stimulate easily or harder. And the risk factor of getting PTSD is experiencing intense or long-lasting trauma. And the second is experience other trauma earlier in the life, like sexual violence, and explore to the job involved trauma event, like military personnel, first responder, which close to the accident or the war, or have problem with substance misuse, like using overdrink the alcohol or drug use, and lacking a good support system, from the family or friends and having the blood relative with the mental health problem. And the kind of traumatic event is more like combat exposure, childhood physical abuse, sexual violence, physical assault, being the threatened with the weapon and accidents. Now we're passing to the next person.
All right. Then we will move into the to understanding the symptom of the post-traumatic stress disorder (PTSD), which can manifest into four categories with intrusion, avoidance, arousal, and change in the thought and feeling. All right. For the first one is the intrusion symptom. Intrusion symptom is involved the involuntary re-experiencing of that specific traumatic event, which can known as unwanted memories, recurrent nightmare, and flashback, severe distress, also physical reaction to the reminders. This for the second one is avoidance system, which known as leading individual to actively avoid reminders of that traumatic event, specifically known when it they will resist some conversation, avoiding thought and feeling, also staying away from the reminder of that specific event. So the next one is arousal symptom. This proof when they show the heightened reactivity to their own environment. This individual mostly may experience some easily startled or frightening, lack of sleep, heightened awareness, also difficulty in concentrating. Next is the change in their thought and feeling. Change in their thought and feeling is involved when the alteration in their own individual emotion and cognitive experience. This can include when they show the lack of joy, mostly in their hobby, and also they have negative belief, mostly in their self, also in their own world. They also show loss of interest, mostly in any kind of hobby or their favorite food and some of their relatives. Sometimes they will have trouble remembering mostly about their old lifestyle and will move into the new lifestyle. They sometimes will show uh, a feeling of the lonely. So that's all for the symptom. We will move to the right.
Okay, right now I'm going to talk about a treatment of PTSD. So typically, treatment for PTSD divided into two, which is psychotherapy and also medication. Okay, I'm going to talk about psychotherapy. So what is psychotherapy? So psychotherapy often refer to as thought therapy or counseling. It is a collaborative and structured form to treat aim at improving individual mental health and well-being. So in psychotherapy, the process involves open and confidential discussion where a person can gain insight into their experience, develop coping strategy, and work towards personal growth. So various therapeutic approaches such as cognitive behavioral therapy, psychodynamic therapy, and humanistic therapy may be employed based on the specific needs and goals of the individual. The therapeutic alliance built on trust and mutual respect provide a supportive space for self-reflection, emotional expression, and development of healthier way of navigating life complexities. So there's two ways of psychotherapy, which is individual and also community. First, for the individual, which is psychologist, psychotherapy with a psychologist involve a collaborative and professional relation aimed at addressing a psychological and emotional challenge. Psychologists who are trained mental health professionals with expertise in human behavior and mental process utilize various therapeutic approach to help individuals understand and manage their thought, emotion, and behavior. Through empathic listening, evidence-based intervention, and personalized strategy, psychologists work with clients to explore the root cause of their concern, developing coping mechanism, and foster positive change. The therapeutic process often revolves setting and achieving goals, gaining self awareness, and enhancing overall mental well-being. This collaborative effort between the client and psychologist, evidential and supportive environment is designed to promote personal growth, resilience, and improve health. So there is two types considered in treating PTSD, which is cognitive restructuring and also exposure therapy. So group therapy can be for community. There is a grouping and also for couple and family. So group therapy can be particularly beneficial for addressing issue such as social isolation, interpersonal difficulties, and providing sense of belonging. If you watch English movie, there's some scene that show a person meeting with other talking about their problem. Usually, they talk about how to stop from breaking habit, emotion control, and many more. Also apply to PTSD patient. So they share the same person. They share with the same person that have a same experience and help them to overcome their problem with different perspective. So on the other hand, family therapy extend the therapeutic focus to the dynamic within a family unit. So it recognizes that individual mental health is often connected with family, relationship, and interaction. So family therapy to improve resolve conflict and enhance understanding among family members. So both group and family therapy aim to leverage the power of collective insight and support, fostering positive change in individuals and their relational context. So the next one, we have medicine. There's a lot of medicine for PTSD, but I only take three. First, we have antidepressant. They are commonly used to treat post-traumatic stress disorder, or known as PTSD. So they are frequently prescribed, including medication like sertraline. This antidepressant can help alleviate symptoms such as intrusive thought, depression, and anxiety associated with PTSD. While they may not provide a complete resolution, they are often a valuable component of a comprehensive treatment plan, often used in conjunction with psychotherapy. So the choice of antidepressant and dosage is individualized, and it's essential for individuals to work closely with their healthcare provider to determine the most effective approach for managing their PTSD symptom. So next one, we have SSRIs, selective serotonin reuptake inhibitors, are commonly prescribed for the treatment of PTSD. Due to their impact on neurotransmitter activity in the brain, SSRIs such as sertraline work by inhibiting the reuptake of serotonin, a neurotransmitter associated with mood regulation, into the presynaptic neuron. By doing so, it increases the concentration of serotonin in the synaptic cleft, enhancing neurotransmission. This increased serotonin activity is believed to positively influence mood, reduce anxiety, and mitigate the impact of traumatic memories and intrusive thought associated with PTSD. The modulation of serotonin level is thought to play a role in promoting emotional stability and resilience. So the last one, we have opiate antagonists. These are not typically considered first-line treatment for PTSD. It is primarily known for its use in treating opioid addiction by blocking the effect of opioid in the brain. However, some research has explored the potential benefit of opioid antagonists for PTSD, particularly in the context of reducing symptoms associated with hyperarousal and re-experiencing traumatic memories. The idea is that this medication might influence the endogenous opioid system, which play a role in stress response. While some studies have shown promising results, the use of opioid antagonists for PTSD is still considered experimental, and more research is needed to establish their efficacy and safety in this specific context. Patients that need to use this medication is essentially to consult with a healthcare professional for the latest information and guidance on the use of opioid antagonists or any medication. So I pass to Saikal for the next slide.
Okay, for the next is case study. Okay, this is report is named as a psychotherapy of 10 years old Afghani refugee with post-traumatic stress disorder associated with the dissociative absence. So this article was written on 22nd July 2022. So this is the timeline of the case study, which is in 2014. This boy, his name is Mustafa, was his father was murdered by the Taliban. In Afghanistan, they will have war. So that the father was killed because of the discrimination of his ethnicity. So after that, the family was leave Afghanistan for avoid the discrimination. So for 3 month journey, they were arrive at the Switzerland in 2015, and then Mustafa start his first symptom in 2016, which is when he first year in Switzerland and first year of school. And then at age of 7, Mustafa was transferred to therapeutic school because of the behavior that was shown during his school life. And then in 2022, Mustafa was beginning his physiotherapy with his therapist. So for this case study, we can conclude that Mustafa has shown a lot of anxiety, which aggressive triggered by ordinary loud sound and by peers. And he emit a heavy frightening image of faceless men fighting, holding weapons, women and children crying, and nightmare of monsters. He complained of fetish due to awakening in the night, worries about his mother and other people in Afghanistan. These symptoms show that Mustafa has facing PTSD associated with this dissociate disorder. So the psychotherapy, the therapist will suggest a diagnosis of PTSD related to early experience in civil war torn in Afghanistan. So after 2 years of long psychotherapy, the memories of the lost father diminished and the patient PTSD and dissociate symptom was remade and his functioning improved both psychologically and socially. So from this case study, we can see that this boy was show some symptom that the PTSD patient was have. And for the treatment, we can conclude that Mustafa has received psychotherapy by the therapist to treat his PTSD. So that's it for our presentation. Thank you.